Today, I have the pleasure to have Brian Crowther from the UETN, the Utah Education and Telehealth Network, here with me to discuss a little bit about the challenges and what is important for system administrator when deploying telehealth projects. For those who don't know, UETN provides infrastructure and support for education and healthcare all over Utah, right? And we've been involved with UETN for some of their recent projects, and we're really glad to see such an organized and talented team that we are engaging on a weekly basis. So we decided to pick Brian's brain and have this chat here to discuss what is critical, more from like an IT or system administration perspective, right? So without further ado, I'd like to thank Brian for being here with us and start asking you to introduce yourself and tell us what is your role and what you do at UETN.
Well, thanks, Messias. Appreciate you inviting me, and I hope that my information is beneficial to you and others. My role is I'm the Senior Systems Administrator for UETN as it applies to telehealth. We are a state-run agency, and we have mandates to serve rural and underserved populations. So that's throughout Utah. And part of my role is obviously systems administration, servers, and other things. But it's also to collaborate with administrators and other department heads to look at telehealth needs throughout our state, as well as determining paths and make decisions on our direction as we move forward.
Yeah, well, pretty busy stuff, right? I can see a lot. But yeah, so in terms of, telehealth projects, right? What is kind of important for you that when you were kind of looking to deploy a telehealth program, right? So again, what is a kind of important or critical for you, kind of even before making the final decision, when you were start looking for like a solution? What is important? It's an open-ended question, but I mean, what is kind of important for you?
Yeah, obviously, as a state agency, we have to write up an RFP to be able to send out and have people to request for purchase and a proposal. And so we have to write up this information, try and articulate what it is that we want the best we can so that we can send that out to people that we hope will be able to give us a product. And obviously, the very first thing that we look at is security. Especially dealing with telehealth. Are they HIPAA compliant? Do they have encryption? Are they able to make their deliverables safe enough so that we can provide those for our clients, so that we can work with the individuals, both on all levels, whether it be through firewalls, transporting documents, whether they're storing any documents, so any business associate agreements, any BAAs that we need to fill out and work with them on, or work with other sub-clients on to be able to make whatever process available. We look at technical support. We look at communication with our team and with our clients. We look to see if they will incorporate our feedback and how quickly they'll be able to do that. As we cover the entire state, we have a lot of different needs, some unique situations that we find ourselves in. And so every product isn't always an exact fit. So we need to look for someone who's willing to be flexible and look at what our needs are and be able to incorporate that into their product. So a lot of things are in there. Bandwidth is a huge consideration because of our rural locations, and special populations don't necessarily have a lot of bandwidth or technology at their disposal. Other things we look at is simplicity, something that's easy to implement, simple for the provider as well as the patient to be able to understand and use. Usually that means that if it is simple, that whoever is putting out the product has done a lot of work and put a lot of pride into their work, so that they can have that as a resource for many of the population. And Also sustainability. We want to make sure that as we join partners with someone, that they're going to be around for more than just a couple of years. Technology companies, as you know, can be quite transient, and we want to make sure that anybody that we partner with is going to be around for a long time and can help us as well as our clients.
Yeah.
And also financially reasonable. We want to make sure that we're not spending so much money, because we're responsible for every dollar that we spend, to the governor and other resources, other entities.
Oh, that's, yeah, cool and interesting that, of course, it's not one feature that you look for when you are evaluating some sort of new technology or whatever in terms of project. So it's a lot that you guys have to kind of look and analyze. So just for my understanding, how many kind of solutions did you look for? Let's say for the recent telehealth project that we were involved with you guys. So how many solutions did you guys look through when you were in this pre-decision process?
Well, like I said, we had to put out an RFP, and part of that is comments that come back to us, as well as some of the ones that we will go out and say, hey, we're putting this RFP together. We think that you'd be a good fit for us. So there's limited. So we looked at about 4 or 5 different options that were available to us through that process. And and then we have to evaluate and look through what our needs are and how well those needs are scored against what our requirements are.
Yeah, no. And you mentioned something about the unique kind of characteristics of Utah being a huge state and with a lot of remote areas there, and some of the challenges that you guys had on the infrastructure side. So can you walk us through the unique challenges that you guys had, UETN had, in terms of all of these rural places in Utah, right? So, and which brought about the decision to implement a telehealth solution in these kind of remote locations in the state.
Absolutely. First of all, this particular project had to deal with schools and school-paced telehealth and help. We have a lot of schools and school districts throughout Utah. A lot of them are very rural, and we didn't have enough money for a nurse to be able to be physically located at every single school. And so we needed a way to be able to provide that service for a student to be able to see a nurse without overburdening the nurses, either by a nurse traveling to a school. So if you have one school nurse per district, there might only be 3 schools, but those 3 schools may be hours, an hour away from each other. And so that really spreads the school nurse very thin if they're at one school. We found through some studies that were published that 90% of kids, if they were able to see a nurse, then they wouldn't go home, and they were able to stay in school. And that was our ultimate goal, is to be able to provide kids the opportunity to stay in school so they get that education and keep them there. So some of the challenges, obviously, is one nurse for many schools, very rural, so bandwidth is a concern. Technical challenges, as obviously not every nurse or facilitator is not going to be a technological genius. And so we needed something that was very simple, very straightforward and easy to use. And so those are a lot of the challenges that we had, as well as financial. Obviously, if we had all the money, we would have a nurse at each location. So, a lot of those things that I even talked about before, as far as what we're looking for in a product, were some of our challenges that we had. Obviously, we're dealing with the entire state, and so that's a lot of people, a lot of schools, a lot of nurses, a lot of things, a lot of moving parts that we had to work. So we had to be able to find a solution that would juggle all of that.
Yeah. And let's say after, though, moving forward on this process for you as a system administrator, when let's say you make your decision, right? So where you guys are kind of inclined to make a decision for one specific technology or vendor. What is then critical for you when deploying a project, right? So, I mean, what do you expect from a technology partner after this initial period, and technically the new technology was also kind of was already validated, and okay, now we can move forward. But what do you expect in this kind of second stage in this kind of relationship?
I made mention a little bit about the feature requests. That was very vital to us because we knew that we would have some unique situations, and so we knew that we might need to tweak or have some input on what our final destination would be for some of these for some of this the product. And so that was very large, open and clear communication. So being able to have milestones and goals, as well as communication as we do the deployment. Obviously, I said that there was a lot of moving parts, and so we need to have a lot of good communication to be able to make that happen. The organization that to choose, we needed them to realize that our success is also their success. If our nurses, if our technicians are happy, and we're happy with the way that the product is being rolled out and being used, then obviously that'll reflect as a huge reflection back on the organization, because or the main organization, because if you can keep all of those people happy, obviously we're not going to be looking for someone else or something else to supply a need. We'll stick with them. So all of those types of things are things that we need, as well as ways to be able to monitor, some way for us to be able to get into the back end of the product, to be able to look at the resources that are there, for us to be able to see when it's deployed, when it's used. Obviously, we're a state-run agency, so we have people that we have to report to on our utilization grants that we write. So we need to be able to have access to that nondescript information that says, hey, when is this used? How is it used? Not necessarily the person that's using it and the reports for a particular individual. It's kind of a higher level or a global look, so that we can put together information so that we can have justification for why we're spending the money that we're spending.
Yeah, no, I'm glad to say that, because I mean, we, of course, I might be biased saying that we have developed a management system to actually help, on the admin side, on the back end, to give, like your team some sort of access to what is important to monitor, right? So again, and we've been engaging for I don't know, since the year started with because of this project, and I'm really glad in how you guys were able to jump on and kind of use the deployment management system that we have. So any words around that? So what is critical, or what you like the most, and when in this stage and deploying, or for your management and monitor? We're not talking about the actual clinical use case, but now we're talking about the IT back end use case on having a platform like that, the one that we offer.
Yeah, absolutely. Yeah, there's huge benefits that we have found. Part of it is that we needed a product that was provider agnostic. So there wasn't just one provider that we had to go with. Like I said, each school district in our state is kind of like their own little mini state. They have their own rules, their own needs, their own possible provider that they want to use, or their own specific nurses that they want to communicate with. And so we had to have a way to be able to have lots of different ways for the patient to talk to the nurse or the provider. And so one school district isn't going to talk to another school district's nurse. So we had to be able to look at that and be able to manage that process. So each configuration is going to be a little different per school district as well. So we need something very versatile. And 19 Labs just does a great job on the back end as far as being able to see who's using it, how it's being deployed, whether it's on the proper update. Also, we can see if one school district is having a particular struggle because all of the devices are coming back with similar errors. So we can talk to the IT administrator for the school district and find out what's happening with their firewall, for instance, so we can have a greater success for our clients using the product, so we can see some of those demographics very quickly and understand what the problem is. Also, the location information that's on tracking that's on the devices. We can see where the devices are, how they're being used, whether they've been deployed or not. Really helps us in the troubleshooting process, as well as obviously the documentation for us to be able to justify the cost of the product. But just tremendous and very easy to walk through those pieces that 19 Labs provides for us.
Nice. Yeah, and you mentioned about each district being almost, and it's a different area, it's different people there, and then you have of course the different people in it at each school. How was training for, we have multiple providers spread all over Utah, and then we have all of the the schools and school staff that we also you guys have to train. So how was the training process?
It was great. When we started working with 19 Labs, that was one of the things that we needed to have as part of our implementation, is that, we've got librarians, office workers, nurses, and like I said, they're not technological geniuses. We needed something that was simple. We needed to also give them some training to be able to bridge that gap between what they may have not known to what they need to know to be able to run the system. And the system is very simple and easy to learn and to grow, and very versatile, but there is some a learning curve that's there. And so working with 19 Labs, we were able to come up with, or 19 Labs came up with 2 training sessions. One for the clinician that just needs to work with the student and connect with the nurse, and another one with the nurses, the provider, to be able to connect and communicate with the clinician. And they just did an outstanding job. There was a couple things that we were looking at specifically. We wanted to make sure that it was easy to follow, that wasn't very long. Obviously, with everything that's happened this past year, everybody's time is very short. The nurses, I've already explained, are hopping around at the different schools. We need something that was concise, informative, something that was not redundant or didn't waste their time or juvenile. So we wanted to make sure that it was also measurable, so that we knew that they actually took the training. And so we also had some questions at the end of it. Nothing that Harvard Law School or anything like that. It was just simple questions, 3 questions that pertain, that were very highlighted, very easy to do, but it also showed that they actually did the training.
They watched the videos and
watched the videos, had some communication there, and it's worked out very well. We've had conversations with people who have gone through it. They rarely have very many questions after, or very many issues with the product. So we've been very happy.
You mentioned that we came up with the training, but of course your feedback specifically, Brian, was really helpful and insightful on how we would kind of build a platform like that. And again, it's like we are really proud of being flexible, right? So for and adapt to situations like that. But again, we rely on kind of minds like yours to help us, because you were in our frontliner, right? So again, the system administrator is the frontliner of the technology vendor. We're not in this case, where you guys are kind of centralizing and then distributing and then managing all of these, like schools and nurses out there. We really need to have this alignment with you. So again, I want to have this opportunity to thank you for the nice work that we've been doing together.
Well, thank you. I appreciate that. But really, like I said before, one of the things we were looking at was somebody who recognized that our success was your success. And I believe that 19 Labs it really does a home run with that. You've listened to what we've had to say, and you've implemented it. And with the training, with other things that we feel like we need, that are important to us, we feel like we've been listened to, and you've strived to implement what our needs are.
Nice. Yeah. Well, so since this is, I don't want this to be about 19 Labs only, but it really kind of talking about telehealth or deployment in general, kind of where do you see, because you are, I would say, exposed to technologies more often than we probably, I don't know, that we are. So any words or like, again, an open-ended question, more like, where do you see these technologies going in the new future, right? Because again, right now, what we see a lot of peripherals being added to the telehealth solution. That's what we do. But again, thinking outside of the box or based on what you have experienced, where do you see all of these technologies going?
Well, that's a great question, and one that I think a lot of people have and have speculation on. Just maybe in a broader sense, I think what's happened with this pandemic is people have realized that the technology's out there for some unique opportunities. One of those is being able to provide care in places that previously either did not have care or didn't have the level of care that we're able to provide now.
Yeah.
Obviously, there are some things that need to be on a one-on-one physical environment,
Yeah.
but there's a lot of things that can be taken care of, vitals, other things like that. We deal with a lot of rural locations, and for some of these people, it's an all-day process just to go see a doctor. And this allows for home patient monitoring, or these are the things that I see coming out of this, or future needs is home patient monitoring, so that people don't have to leave their home, whether that's because they're elderly, they're infirmed, they might have special needs, but being able to have the heart monitor or a blood pressure machine or somebody, the diabetic, to be able to do some of those tests, those quick tests, and be able to get that information in the hands of those people that may be their primary care provider, or someone who is knowledgeable enough to be able to recognize and see that data and help them save money for, I mean, it's not just the cost of the visit to the doctor, it's the drive, it's the time, it's the, all of that process. So as well as our nursing and environment with our schools, to be able to help them to better serve the students that are underneath their care. But mostly I see it as just more options for patients' health to be successful. So I see that patient success increasing because of the awareness of the technologies that we have and the embracing of them that we've been able to experience over this past year. So I see, I see just growth in that environment. Also mental health. Our mental health needs have really had some trials, I guess you could say, this past year, and we've seen a growth, especially in our schools, where that need is there. And so being able to have these resources at their fingertips has been just incredible. So I know there's been talk of trying to find or trying to create more a better way for someone to be able to follow their own or keep track of their own health resources. And that's something that I've always looked for and thought would be a good idea. If I broke my arm 2 years ago, it would be nice to have those medical records with me rather than at the medical facility. So some way to be able to securely do that and be able to transfer those medical records between or be able to share between entities, I see as something that's important in the future. But there's so many things that encompass that with security and protection and things like that, user protection. But that's a challenge. But I think at some point, I hope we get there.
Yeah. Well, again, from the technology side, that's what we hope to, right? To actually being able to help those who need it most with technology, and understanding that affordability is also important. We don't want to create a solution that would cost $1 million, because this is not a solution, right? But anyway, no, pretty cool, man. I mean, I appreciate. For me, I would stay here with you for hours, but we know that we want to make this a kind of a short video. Really, thank you, man. Thank you for having the time being with us today. And yeah, I mean, we'll see you soon, right? And I'll give you your kind of any closing remarks you want to say. So that's, the mic is yours now.
No, I just want to say thank you for this opportunity. I appreciate it. I feel flattered that you would be willing to want to spend a little time with me. So I appreciate, like I said, everything that 19 Labs has done, as well as the opportunity to be able to talk about telehealth. It's been a passion of mine, and it's been very exciting to see this particular industry grow. And I'm just excited to see where it leads us. From a handheld telephone to be able to video conference. I mean, that if you would have told that 20 years ago,
Yeah.
oh yeah, by the first cell phone, you'd be like, no, that's no way. And so just seeing this industry grow and how it's being incorporated and the technology that's being used, I'm just excited to see what happens next, and the smart minds that are out there to be able to develop it. I'm excited.
Good. Yeah, we're excited to. Thank you, Brian. And well, take care. I really appreciate it.